When things go wrong for men in the bedroom, we at face value accept that it can be biological. When things go wrong for women in the bedroom, we think it's psychological. It was 1998 when we first got Viagra approved for men. 2011, there are 26 drugs for men on the market and not a single one for women. Addie has been named the female Viagra. There couldn't be a moniker further from the truth. For men, it's a blood flow issue. In fact, Viagra was discovered as an interesting side effect of a blood pressure medication. It's a very different story for women. Desire is in fact in the brain, and we know that from brain scan studies. If you take a woman with that condition and a woman who has normal desire, put them both in a functional MRI, expose them to erotic stimuli, their brains light up totally differently. There's a neurochemical imbalance for some women who have a lack of interest in sex. It's about 7 to 10% of the population. The prevalence rate of this condition for women, hypoactive sexual desire disorder, is the same as the prevalence for erectile dysfunction. That's a $6 billion category today. We had to demonstrate that we increased desire for sex, we had to increase the number of satisfying sexual events, and we had to decrease distress. We met all of those endpoints, and yet a conversation still swirled around, well, how much is enough? It was on the basis of a societal narrative around female sexuality. When you say women and sex, people have an opinion. The efficacy of this medication looks like those drugs that we understand that work on the brain. What's the most common one we understand? Antidepressants. If I treat a patient with depression, my goal is not to make them euphoric. If I treat a woman with hypoactive sexual desire disorder, my goal is to restore her to a normal she once knew. As a society, it is this construct of psychology first for women, biology first for men. You can look at data even from ERs in terms of how much longer a woman will wait who presents with exactly the same symptoms as a man. And that completely hinders progress and frankly propels a lot of myth.